engage in dialogue and debate. That very much is part of fortune. And he went so far as to say that he needed to send some of his folks to West Point so that they could understand leadership, systems thinking, and the power of conversation. You're going to hear about systems thinking and the power of conversation in the next few minutes. As we talk about core change, an initiative about igniting our strengths, and looking at things from a systemic standpoint. Now behind you is a graph that shows one of the reasons why I became more than just a law, I'm motivated to do something about the inner city violence that we were seeing. What I'm going to depict for you now are the imperatives of why we need to rethink how we are pursuing these, what I consider the cluster of perfect storm, and how we need to rethink how we interact as we try to do this. During my tenure as the chief of the trauma service, we saw a dramatic increase in the number of adults in our area killed as a result of gunshot wounds. But what was most disturbing to me was a 300% increase in the number of children coming in with gunshot wounds to Cincinnati Children's Hospital. When I was under the tutelage of C.A. Recoup as a pediatric surgical resident, it was not taking care of gunshot wounds that was my degree. It was looking at babies with tracheoesophageal fistula, just congenital anomalies. But what was particularly disturbing to me, as I'm sure it is to you, is that the average age of the child coming in with gunshot wounds was 12.9 years. We were seeing a decrease in the age range of children coming in with gunshot wounds. And in some cases, these were repeated. What I'm going to suggest to you is that if we look at these critically, we'll see that there is a clustering of what I would call entities that make up a perfect storm. Cincinnati, this region, has the highest infant mortality rate of any city, any region, any county, state. As a matter of fact, there's some developing countries that have a higher survival rate than we do. Now we're making some progress here. This is a focus of Cincinnati Children, so we're making some progress. But I would submit that if we looked at it from a systemic standpoint, if we looked at the root causes, if we looked at it with systems thinking, and looked at the leverage points, that we could potentially accelerate the good work that's being done. Added to this, then, is that we have successfully in this country incarcerated the largest percentage of our population than any other developed country in the world. At great expense to us as taxpayers, to us as mothers of children going to school, or parents. Because the money that's being spent on prisons is at the expense of money that can be spent on education and on healthcare. The only country that is second to us by orders of magnitude is Russia. We have successfully arrested more of our population than was arrested at the height of apartheid in South Africa. And when you look at the hidden cost, the externalities, as our business colleagues would like to say, we see that not only is it the most rapidly growing segment of most states' population, but that these young men and women have the following characteristics. They are released, 90-some-odd%, that if they are not employed within 3 years, almost 2/3 of them are back in prison. And so we have then this not a virtuous cycle, but a vicious cycle. And when they leave, they are now branded, and their life chances are ruined. Michelle Alexander has been here once, and will be coming back again, and will tell us about this as really being the emergence of the new Jim Crow. Young men and women whose life chances are altered forever. Their likelihood of getting employment is less than 8%, and that was before the economy went south. And what further research has demonstrated is that where this is concentrated, typically in communities of concentrated poverty, which typically is a community of color, not necessarily African American, but it can also be brown or Asian Pacific, that the community itself is made worse. If a parent is in prison, that child has about a 30 to 40% greater likelihood of going to prison. Now, what many sociologists have tried to tell us in public health is that this is clustered in areas, and that clustering, that phenomenon itself, results then, again, in a reinforcement of many of the drivers that contribute to not just the violence, but what I would submit to you is you think about this as system thinkers for a day, is that the same root causes that contribute to violence are the same ones that contribute to child abuse, that contribute to premature births, that contribute to obesity, that contribute to asthma, that contribute to community disinvestment, so that anyone who can leave will leave, and that there's a further concentration of poverty, and the cycle begins again and again and again. We have, in a handful of communities, a perfect storm. A perfect storm. That without intentional intervention, not from some higher entity, but from the processes that we have embraced within core change, will continue to progress and worsen, and I think will impact our ability to be competitive in increasing the global economy. Now, the traditional approach from a healthcare model is to really focus on the things to my left, your right, depending on where you sit. What core change with its thinking and methodology proposes is that if we're really going to make profound change, we need to look further upstream in the model. Because what the research clearly shows is that even though our traditional approach is to look at individual behaviors, the research clearly shows that if you're going to really have a profound impact, you need to look further upstream at what now we're looking at as social determinants of healthcare disparities. I don't know what I can do to help this. It's going to get time. Any suggestions for
Yeah, do you have a phone?
Put your phone on the table.
I'm bad. So this has actually caught the attention both historically of some great people and more recently. Martin Luther King said that the greatest form of inequality, of all the forms of inequality, injustice and power, is the most shocking and the most inhumane. And Bill Gates has said, really, we should be looking at the awful inequities in the world, the appalling disparities in health and wealth that condemn millions. He had no awareness of this when he was at Harvard. But as many of you know about the work of the Bill and Melinda Gates Foundation, this is a focus on their part. And really, what we should be known for is to what extent that we're able to then alleviate these inequalities. I'm going to show you a brief video clip to sort of bring together the research that has come to our attention and that has helped train and inform my thinking about so we don't have speakers.
Put the mic next to you.
And step aside.
All right, so we will, we're having technical difficulties. So what this video showed, there was a doctor